Good afternoon, friends, and we have Dr. Indranil Banerjee, consultant uro-oncologist and robotic surgeon, with us today. And we have come back again with our Facebook Live session. Today's topic: what is bladder cancer and what are the warning signs? So, if we could just have an introduction on bladder cancer.
Yeah. Hello everyone. Firstly, we will start with what is bladder. Urinary bladder is a hollow muscular organ and which stores urine and which helps you to pass urine also. And what is the cancer? Cancer is abnormal growth of cells inside your body. So if the cancer arises from bladder, it is known as bladder cancer. Now why bladder cancer is a burning issue nowadays? Because every year globally 5.5 lakhs patients will be diagnosed with bladder cancer, around 2 lakhs patients will die from bladder cancer, and in India every year 80,000 patients will be diagnosed with bladder cancer, and it is projected by the year 2040 around 40,000 patients will be diagnosed with bladder cancer. So if we catch the bladder cancers early, then we can cure these patients.
Sir, we have a few questions lined up on this topic, and we would really love your answers on them. The first question that comes to our mind is, how does a bladder cancer patient present?
Yeah. So many patients may be asymptomatic, that no symptoms, but most common symptoms that the patient present with is blood in urine. Now the blood in urine may be microscopic, that means it can be only be seen under microscope. When you do a urine test, then you can see it, or it can be macroscopic, that means you can see blood in naked eye. That is the most common symptom, and most of the time it is painless passage of blood in urine. And other symptoms may be painful urination, there may be difficulty in passing urine, and if the bladder cancer has progressed outside the bladder, then there can be back pain, weight loss, loss of appetite, and all those symptoms can start.
Right. So, to the next question, we have just discussed how the cancer patient presents. Who are the patients at risk to develop such a cancer?
Bladder cancer is usually a disease of older patient population. If you are more than 55, there is a risk, but the mean age population is 73. If you are a smoker, then bladder cancer, it has 3 times more chance of development of bladder cancer than if you work in the plastic industry, dye industry, or in tannery industry, or in the petroleum industry. There is always a risk of bladder cancer. It has also been proven that if there is high level of arsenic in water, then you can develop bladder cancer also.
What are the investigations that you would suggest for evaluation?
Yeah, if you have blood in urine, in naked eye, or in urine test, you should definitely see a urologist or uro-oncologist for a further evaluation. You need to do he will do a physical examination for proper evaluation, then will do a urine test that will include a urine analysis and also a cytology. Cytology means looking under the microscope whether there are any abnormal cells in urine, and also he will order some blood tests along with CT scan or MRI, and he will do a cystoscopy. Cystoscopy is putting a small tube inside the bladder, which is connected to the camera and a light source, so that you can look inside the bladder what's happening in the blood. That's the next step. Yeah.
Since we've been discussing bladder cancer in such depth, if you could tell our audience what are the different types of bladder cancers?
Yeah, I mean, the bladder cancer can be, bladder is a very muscular organ, as I've already mentioned, and yet different layers are there. So if it is arising from the inner layer, small thin inner layer, usually that is a site of origin for bladder cancer, and it is not going beyond, not in the deeper layer, deep in the muscle, then it is known as non-muscle invasive. If it is going into the muscle but still inside the bladder, it is known as muscle invasive bladder cancer. So broadly 2 types.
So, how would you treat bladder cancer that is not involving the muscle layer?
Yeah, the not involving muscle layer, that means you have detected the bladder cancer early by doing a cystoscopy. When you see those not invading the muscles, you just can do a endoscope in. That means that small tube connected to the light source and camera inside the bladder and scrape off the tumor. That is the treatment. And the good thing is that is not invading the muscle. The bad thing, there is a high chance of recurrence or the disease coming back. In that case, you will need further follow up multiple times. You have the urologist need to do a cystoscopy to find out if the cancer has come back or not.
And if the cancer is involving muscles?
Then it's a little aggressive cancer. That means it's going into the muscle. Deeper layer is a more chance of going outside. Then you have to stage the cancer, whether it is still in the bladder or outside, with a CT scan and PET scan. And then there can be different treatment. The treatment options depends upon the age of the patient, how much fat the patient is. If the patient is fat, young, then obviously we would rather go for cystectomy. That means removal of the bladder. And if the patient is not that fit, patient may have radiation along with chemotherapy. Only radiation doesn't work in these cases. So if you combine radiation along with resection of all the bladder endoscopically along with chemotherapy, that is the treatment option.
You just mentioned briefly about the cancer spreading outside the bladder. So if that happens, what do you do?
Yeah, that's a difficult part to treat. Then we will refer the patient to the medical oncologist. They will give the patient chemotherapy or immunotherapy depending upon the kidney function.
What are the chances of survival from bladder cancer?
It depends upon the stage of cancer or grade of cancer. Stage means how deep the bladder cancer is going inside the bladder or outside. Grade means how aggressive the disease is. If it is a early stage cancer not invading the muscle, the patient can survive for 5 years. 95% patient will survive. For if it is going into the muscle, then survival decreases to 70% in 5 years. It is going into the lymph node, the glands, then survival is 35%. And as you have just asked about the metastatic, that means the cancer has spread to the other parts of the body, survival dips down to 6%.
Cancer, as we have heard, is a lifestyle disease. So any ideas that you can give us as to how we can prevent bladder cancer?
Sure. We have discussed the risk factor for bladder cancer. If you remember, one is smoking. So the patient should try to avoid smoking. That is the single most important risk factor. Stop smoking to prevent bladder cancer. Next is have a healthy lifestyle, do exercises, eat more vegetables, more fruits. Try to eat purified water, drink purified water, so that because arsenic, high level of arsenic can cause bladder cancer. These are the things that can help you to prevent bladder cancer. And also I have forgotten to mention that drink at least 2 to 2.5 liters of water. If you drink a lot of water, then there will dilution of urine inside the bladder, so less chance of development of bladder cancer.
What role does robotic surgery play in treatment of bladder cancer?
Yeah, thank you for asking that question. In the year 2021, we should definitely talk about robotic surgery. If you, as I have already discussed, if it is involving the muscle, then the best thing is to remove the bladder. So how to remove the bladder? You can do open surgery with a big incision in the belly, or you can do a robotic surgery, that is a minimally invasive, very small incision. Now a trial, the RAZOR trial, which is a landmark trial published from my previous University of Miami Hospital by my mentor Dr. Dipen Parekh, who has described that if you do a robotic surgery for oncological outcome or cancer specific outcome is similar to open surgery. So robotic surgery is not inferior for cancer outcome, but you have less blood loss, less hospital stay, less pain, early discharge from the hospital. These advantages are there. They again published about the quality of life of robotic surgery is as compared to the open surgery is similar. So in the year 2021, if you have a muscle invasive bladder cancer, then definitely you can think about the robotic surgery with maybe a better outcome in terms of quality of life.
We've covered almost all the points that have generally come to our minds. So before we conclude this session, we would love to hear a summarization of what we discussed today for the understanding of our audience here.
Sure. So my mantra to treat bladder cancer is catch it early for cure. That means if you, as I have already mentioned, if it's a non-invasive bladder cancer not involving the muscle, then the 5-year survival is 95%. So if the patient have blood in urine, you can see it in naked eye or even in urine test, then you should see a uro-oncologist for further evaluation, so that you are not missing a bladder cancer, and we can catch it early before you become symptomatic or the bladder cancer has spread to rest of your body, so that the survival dips down to 5%. So that will be my advice. Thank you.
Thank you, sir, for sharing your thoughts and connecting with our audience today. I'm sure we'll get more questions, and we are sure we'll get them answered as well. Till the next session that we do with you, sir, thanks a lot from
Thank
the
you
team
so
here.
much. Bye.